Welcome to the Birth Squad podcast. If you're riding with the squad,
hey fam.
And if you're new,
welcome to the squad. We're your hosts, Dr. Ijama Okwando and Dr. Kanisha Thomas. We're two licensed obstetrician and gynecologists, as well as best friends.
The Birth Squad is a podcast for birthing individuals by two Black female physicians who use stories from real women to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope that you love learning from our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. So please consult your healthcare provider for your specific care. And to learn more about us and about the podcast, please follow us on Instagram at The Birth Squad. And also check out our website, thebirthsquad.com.
Please keep in mind that some of our episodes may cover topics that could be triggering to some individuals. Listener discretion is advised. Well, welcome everybody back to the Birth Squad Season 2. I'm Dr. Kanisha Thomas.
And I'm Dr. Ijama Okwando.
And today we have an amazing birth warrior that's going to share her story and her life with us, Dr. Aldene Zeno, So she is a trained OBGYN and a urogynecologist by trade. She's also an author. She wrote an amazing book talking about pregnancy and fitness, and we'll go over that today in our interview. And she's also a personal trainer as well as a mom. So welcome to the Birth Squad, Dr. Aldene Zeno.
Happy to be here. Thanks for having me.
So we want to kind of start the journey and the conversation today talking a little bit more about you. Like, you have a lot of hats that you wear, and we're curious what got you on your path. First, let's talk about with medicine. Like, what got you interested in being a urogynecologist? What is a urogynecologist for those out there who don't know? And then we can kind of delve into some of the other hats that you wear.
Yeah, I mean, as far as being a physician, I've always been into like sciencey stuff. I originally wanted to be a marine biologist just because I like dolphins, but I think it's partly having an immigrant mother and this being kind of a traditional, role that a lot of immigrant parents see as being successful. But I think that just kind of also met my interest in medicine. And she was a nurse also. And so I, remember playing with her, blood pressure cuff and her like suture removal kit when I was little. And, but I think when I was coming out of high school, I originally thought I was going to go into nursing school. And one thing I really do credit her with is just helping me see myself as a physician, or the potential to become a physician, even though that wasn't something I was seeing a lot growing up. I personally had a pediatrician who was Black, but I didn't have a lot of like other experiences with physicians as people of color. Like, we also grew up experiencing poverty and that kind of thing. So it really, even though, I had good grades, all that stuff, but, just didn't seem like that was going to be me. And then as far as urogynecology goes, I originally went to OBGYN because I like doing procedures, and I thought I was going to do family med and, to do like maternal child health and do more deliveries and that kind of thing. But I was fortunate to have several international experiences, including I went to the Philippines as a medical student for a month and was there with my mom when she was getting her BSN as a nurse, which was a really cool experience. And she was on a rotation there, and I was at the government hospital too at the same time. So that was cool that we were able to coordinate that. But then I went back as a third year med student, and then also had the opportunity to go to Guatemala with a urogyn. And my experience in residency was that urogyn I was in a more affluent area. I was in the Bay Area, and I thought it was more of a cosmetic thing. And I don't think we also weren't really exposed until later in our training, but I thought it, is more, like bougie people that just want their like labioplasties, or, they want their labial trimmings and to tighten things up down there. But the issues that we deal with in urogynecology are so prevalent. At least half of women postpartum are dealing with incontinence or some degree of prolapse. And as we go through menopause and get closer to 65 and above, somewhere closer to 2/3 of women are dealing with issues related to incontinence. And that has a
Mm-hmm.
huge impact on nursing home admissions, on quality of life and mental health and productivity and image and self-worth and things like that. So doing those international experiences and seeing how universal these issues are, and being able to address that through often through procedures, not always surgery, but often through procedures that can be true, I call them true gynecology procedures, but to have that kind of impact and to make a huge difference in somebody's quality of life that way was very impactful for me. So thankfully I had some great mentorship, even though I was in a program that at that time hadn't had many people go into urogynecology. And it's one of those things, just like a lot of other subspecialties in OBGYN. A lot of people, if they know going in, they'll choose a program where they have, they have a fellowship program there, they have other mentors, and my program didn't have any of that. But again, I'm thankful for the experiences I had and great mentorship to kind of help lead me down this path. And now, being in private practice, I'm kind of experiencing another iteration of dealing with pelvic floor disorders in a more community-based setting, as opposed to academics, where I was for the previous first 3 years after my training. So again, I think for me just has reinvigorated my commitment to clinical care and to being a resource in the community, and being accessible to my patients here, and also through avenues like this, and our options, whether it's social media or writing or podcasting or whatever, to talk more about these issues that are just so common but also very taboo. So
Yeah. We really appreciate the work that you do, because you're right, it does affect so many women. And I feel thankful that I have you as a resource that I can refer patients to.
yes.
And I can attest to how happy they are with the care that they receive from you. So I want to kind of like transition it into talking about your experience, your personal experience, and motherhood specifically. So if you don't mind, I'd love for you to share with us your path towards motherhood, and then maybe we can kind of segue into talking a little bit about your book and how that process kind of came about.
Sure. So I'm one of those people that grew up in a pretty conservative or religiously conservative household, and the type of household where, like, if you were in your late 20s and you weren't married and like planning your next child already, you're kind of failing in life. And I definitely internalized a lot of those beliefs, and I got married pretty young, and thought, okay, I'm going to finish my training, got the
Mhm.
husband, I'm going to get the degree, and then I'm going to plan this, motherhood thing out. And, life happens and you gain wisdom and everything. And I found, or even though I'd been dating this person for a while, I found early in our marriage that it was just not going to be conducive to the type of relationship I wanted to have in marriage and family and things like that. But
Mhm.
I still, carried this desire to want to have a child. And so we did end up getting divorced, but, thankfully I was blessed to meet my current partner, and we both have similar like family goals and things. And I definitely, because of my experiences, kind of reframe what it means to be a woman, what it means to have worth as a woman, what it means to become a mother, and like do that in the context of, non-traditional family, even though, you know, somewhere around like 40 to 50% of women of families are blended. So I, gained those insights, and originally, as we, my current partner and I were thinking about this, he'd had experiences with male factor infertility in the past, and I'd never been pregnant before. So, at the time I was like, oh, we'll see kind of what happens kind of thing. My friend calls it pulling the goalie when you take out your ID, but I was, thankfully I was able to get pregnant in, um, less than a year. And, thankfully I had a healthy, normal pregnancy, and becoming a mother, I think, is exactly as I thought it was. Like I felt like I knew a lot about pregnancy, labor, delivery, having been trained as an OBGYN. And like to an extent that was became true, but being a parent is totally different, and learning learning as you go experience, as much as I think one wants to be prepared at things. So yeah.
Nice. So your book is called Thriving Through Pregnancy with Fitness and Black Mama Magic. It talks about fitness and pregnancy. Can you tell us about how your personal experience, like what led you to writing the book, and then what was your like personal experiences that kind of contributed to that? Because you have great photos in here. Like
Oh,
I
thank
was
you.
showing Ijama some of the photos that you have in here from your pregnancy, and like you exercising, during pregnancy. So I would love for you to kind of like speak a little bit on that.
Oh, yeah. And I should shout out my book contributor, Siobhan Robinson. She's a athlete and personal trainer herself, and she was the one in the picture you just showed. But I do also have pictures of myself during my
Oh,
pregnancy. And
okay.
one thing I will say, speaking about the kind of path to motherhood and things, and I think a lot of people have this ideal, or and athletes probably especially, to get themselves kind of body ready for a pregnancy. And for a lot of people that means through fitness and getting to a normal body weight and things. And I talk a lot in the beginning of the book, like I have a whole chapter on preconception, about how I had to learn through my own experiences that fitness was just a part of that journey towards wholeness and wellness. And I had to put that together with the personal work, and going to therapy, and developing wellness techniques for myself,
Hmm.
in addition to having a healthy relationship with fitness. So as I was in fellowship, because I remember you get like crazy, I don't know about you guys, but you get crazy advice about becoming a mother when you're in training. Like I don't know other industries where, and it comes from other women. So, but it's in this context of a very misogynistic training culture. Like I do think that the way medicine is set up currently, because for the past 100 years it had been male dominated up until recently, and now we're seeing that a lot of medical schools are like slightly more female, and then OBGYN is predominantly female. But I would get advice, like I remember I had an ED doc say, just do IVF when you're ready, and so you can time it and you don't have to worry about it, and that kind of thing. Like just very dispassionate, weird advice. And I had, somebody else say, make sure you have a baby like in fellowship, because you'll have good health insurance then, and you don't know what's going to be like when you get out. Like you're talking about like creating a whole other human and basing their upbringing on these, to me, what now seem to be trivial things, but to each their own. Anyways, so I think, I had some of these things in mind, honestly, as I was going through my own fellowship. And at that time I was like, okay, I'm married, I get like a year of research time. And I'm just gonna like try to plan this and get myself in shape so that, when that time comes, I'll be ready. Which, like, in hindsight, it's like that just sounds so crazy right now. But so at the time, I was also unpacking a lot of emotional stress from having gone through training. And I had a, as on a personal note, like had a case that went to arbitration from my intern year. And as we know, OBGYN is a very litigious field. But it was from something that happened like 5 months into my training. And in hindsight, again, I was an intern, and but at the time I internalized a lot because, one of the pieces of advice I got at that time was not to talk to anybody but the lawyer. So I don't think that person that said that meant that. They probably meant talk to the right people, not talk to everybody. But what I took from it at the time was to internalize everything. And so I unpacked a lot of just emotional trauma from that comes with that experience, in addition to things from like my childhood and things like that. So I did start going to therapy, but in my mind, a healthy outlet for that was also to be active and to do fitness. And as much as I love CrossFit and certain things about CrossFit culture and functional fitness in general, it's definitely easy to get wrapped up in that and to also take that to a negative level where you're using that in what's not intended for. Like it's not intended to also substitute for you know the emotional connection with actual people in your life. And for me, like began that I noticed, in hindsight, became part of the issue in my relationship with my partner at that time. And so on one hand, I was achieving that goal of becoming very fit. I was in the gym like a couple hours a day, several times a week. And I started doing competitions and things. And then I ruptured my Achilles tendon. And I don't think it was specific to CrossFit. Like I've been active my whole life. I did cheer and I used to do a little tumbling. And I was a four sport varsity athlete, like all 4 years of high school. So I was one of those people that like dabbled in a lot of things. But so for me to do CrossFit was a kind of a natural transition. It's kind of like adult PE, and it can become like a team sport because you have these opportunities to do competitions and things, and it's fun. But again, like I definitely sacrifice certain things, and so definitely like having a kind of a very significant injury like that where you have to just literally sit down for several weeks or months and then just having that slow recovery, you have nothing to do but to kind of rethink what you're doing in your life and things like that. So I came into fitness and like preparing for pregnancy with certain things in mind, but definitely learned things along the way. And I would say I eventually, was able to, I think, develop a healthier approach to that. And, thankfully now, like my partner and I share that interest in fitness in common. We're both like, he's a trainer, he has a small business with a mobile gym and things like that. But we also have this, and we can connect that way, but we also have this commitment, obviously, to our kids and to our family and to, thinking about their futures and, doing that together. So definitely, becoming a parent helped me kind of reframe so many things in a lot of ways.
So then what do you think that you did that was really successful during your pregnancy? Or what would you tell your friends and your family? Like, these are the things that I would recommend for you to do, kind of maintain your health during pregnancy. Because what we see a lot of is people are afraid to do anything. Can I walk?
Mhm.
Can I run?
Yeah.
And so I always tell them I knew someone who did CrossFit in pregnancy,
Hmm.
and I always keep you in
Yeah.
mind. But like,
Yeah.
what's the big takeaways that you want people to know about?
Yeah. If I could boil it down to two key points, one key point is that um, exactly what you said. I think a lot of people overestimate the risks related to being active and being pregnant. So when I love the recently updated ACOG guidelines on fitness and pregnancy because they're very they're much more evidence based and they're very clear. Like we want people to participate in moderate level exercise in the same way that we recommend for people that are non-pregnant. The difference is that your body goes through these changes and you have to make modifications. But the thing that remains the same is this idea of relative perceived exertion. So when we talk about like moderate level activity, that means that you have difficulty completing a complete sentence while you're active. So that point remains the same, but that means, yes, when you're pregnant, potentially walking, around the block or doing a brisk walk is going to get you to that point. Whereas, pre-pregnancy, you might have been running or whatever. So you just have to kind of pay attention to what that means for you at your point in pregnancy, and also, that changes as the pregnancy progresses. Like first trimester, early second trimester, you probably don't have to change very much. So that, that point about staying active is just so key, because so many Americans especially have sedentary lifestyles. And I do think it's also especially important point for Black women in pregnancy, because stats that are coming out about Black maternal health, they're so important about the risks, the relative disparities in maternal morbidity, mortality, the relative disparities in low birth weights and preterm births. But overall, those risks are low. Those disparities need to be addressed, but those risks are low, which means that the most likely thing to happen for most Black women in pregnancy also is that they're going to go on and have a normal pregnancy and normal delivery. So with that said, it's just as important for us to also uplift stories about successful, active women in pregnancy, which is part of the driver for me to write this book. But the second point that I think is also important is that I think a lot of people are having this better awareness about, okay, it's, safe to be active in pregnancy. But a lot of the guidance that I hear from people in the gym or in fitness culture is that, well, if you're doing it before pregnancy, then you can keep doing it. And that's not necessarily true either.
Right.
And I realized when I was writing the book, and I've reread it so many times now, but I spent a lot of time talking about pelvic health, because a lot of the things that I deal with when it comes to things like incontinence and chronic pelvic pain and prolapse, these are things that a lot of my patients are dealing with 10, 20 plus years down the road from their pregnancies. And usually it's at that point that it gets so bad that they need attention, and also they're kind of out of that, taking care of young children phase. But I think that what I hear from a lot of my patients is that if I had known this, I would have done things differently. And unfortunately, we don't have a lot of great evidence on prevention when it comes to pelvic floor disorders. But there are some common sense things that people can do differently. So I talk a lot about, like, if you're leaking while you're doing squats, don't keep doing that. Like you might have a higher risk of doing that in pregnancy because of some of the hormonal changes and the physiologic changes and that kind of thing. So, other things like if you were lifting heavy before pregnancy, you still have to keep in mind, the relative changes that are happening in your body, where yes, you are going to get short of breath faster. You are going to fatigue faster as the pregnancy goes on. And then certain movements, especially, some people get really bad hypotension or low blood pressure and later in the second trimester. Or first trimester, second trimester. So there's certain things like movements, if you're doing like burpees, for example, where you're jumping up and down a ton, or you're putting your head below your heart a lot, like that might make you more prone to get dizzy, or like, as the pregnancy is going on too. So, but my belief is that those movements can be modified. It doesn't mean stop exercising, unless, again, in certain situations, high risk for preterm birth, or, if there's other things where the obstetrician says that they need to avoid certain activities, yes. But I think the challenge also for us as providers is that we're also, as a community, are giving mixed messages to patients. So a lot of patients are like, I don't know what to believe. So I tried as much as possible to stick to evidence-based guidance in my book, but to also use that through my own experience. And I really didn't see a lot of that when I was looking for something like this, a resource like this. And it was during the pandemic, and there's a lot of influencer experts who are posting on this stuff online, but there's not a lot of great research behind it or a lot of evidence behind it. So that was a lot of, the impetus for me to write this, was to hopefully inspire people through my own experience, but also to provide some evidence-based guidance.
It is, I mean, definitely needed. And I think, it's funny because I think patients think we get trained on everything. Like we have like in training, we have a class on like the right underwear or the right like products to use or the right hair
Yeah.
dye to use.
Yeah.
But we don't, right? And
Right.
ACOG comments on it, but there's no class on fitness and pregnancy. So
Right.
I think your book is very, very important and it's very needed, and it's a important voice to be heard, and it's such a unique perspective as a urogynecologist too, right? Knowing a lot about the pelvic floor, which plays a huge role in our fitness and a huge role in pregnancy.
Mm-hmm.
So like, I just want to take a moment to say thank you for taking the time to write this book, because it is really, really important. And I remember when you told me you were going to do it, I was like, I have to talk to you on the podcast because I was like,
I'm
this is
really
good.
thankful to be here. Appreciate that.
Oh, great. I want to ask you if you could pinpoint anything, thinking about that, thinking about your prior experiences and your knowledge as a urogynecologist, do you think there's anything that really helped you, like during delivery, like some things that you did during delivery or immediate postpartum, that you can like pinpoint that you feel like really made a difference for you?
Yeah. One thing I talk about in the book is that there is evidence to show that people who are engaging in moderate or even high intensity exercise throughout their pregnancy go on to have a lower risk of C-section, and they're more likely to have normal birth weight infants and less risk of large for gestational age infants. And we, as you guys know, but that improves your chances for a healthy delivery. It decreases your risk for birth-related injuries, and increases the chances for the baby to have themselves less injuries during their delivery, and also for the baby to have a better metabolism and lower risk of low blood sugar after delivery, or hypoglycemia in neonates, which we associate usually with larger for gestational age infants. So there's so many benefits, and I had that in mind, and I do think that helped in my experience with having essentially a normal labor and a pretty a remarkable delivery, as far as when it comes to medical stuff. Obviously for me it was a very remarkable experience, but my partner always jokes, he's like, you like basically delivered your own baby, because I came in and I had my bag of water had ruptured, but I felt confident that my body would go into labor on its own. And one of your colleagues, I delivered at your hospital, by the way, but one of your colleagues, I'm not going to name any names, so one of your colleagues called me after, and she was like, we were watching that tracing, and I think I was having variables or some signs that like maybe sometimes we associate with fetal distress, but usually it's fine. She was like, we were watching this and we knew you had like ruptured early and weren't quite in labor yet, so we were thinking about recommending PIT, but I would have probably said no anyways if I but I don't know how to describe it, but I felt confident that my body would do the right thing, and thankfully it did. Like I'm not so hard-headed to have stuck to my guns if I truly was stalling in labor, but I knew what a normal labor curve was, and I knew that for people that rupture their bag early, most people deliver within 24 hours. Or go into active labor within 24 hours. And that's exactly what my body did. One thing that I think in hindsight, I realized if I'd had like a midwife, or because I do think as OBs, we spend so much time around abnormal deliveries, and have to like admit that we've seen some traumatic things, that sometimes we do act out of this desire to avoid that, but sometimes that's fear-based, right?
Yeah.
But one thing that if I had worked with a midwife, now in hindsight, I knew like that day, I remember I was so hungry. I ate like nobody's business. Like we went, I think we had McDonald's for breakfast, then we had ramen for lunch, and then we went to Cheesecake Factory. And by the time I got to Cheese Factory, I was like, oh, I'm starting to feel a little nauseous, but let me power through these tamales real quick, this tamale cake. But so I think a midwife would have probably counseled like, oh, like that's very common when people are like getting ready to go into labor, and you kind of want to make sure you pace yourself, because once I did start going into labor, I would like the thing that made me get an epidural really was the throwing up. Like I hate throwing
Mm.
up, but it was like with every contraction, I was just like, ugh, like, and it was like all that junk I'd eaten for that day. And it was funny too, because like I knew having ruptured my bag that I, wasn't having contractions yet, but I knew that I would probably in the next like few hours. So after that happened, I showered, and then I actually stopped at Walgreens and got like a continence pad, and then picked up a ton of snacks because it was the pandemic, and I was like, if we're gonna be
Oh.
like barred from leaving this hospital, my partner and I, like we're gonna have all the snacks. So
Mm.
I had like Reese's and like all these chips and stuff that I ended up not eating because I was so nauseous and throwing up the whole time. But anyways, my and then my partner at the time, he was on nights. He also works as a in law enforcement. And so he was like so tired, and I'm exhausted because I've been like up and throwing up, and it's the middle of the night. But he just remember like he told me he would look over, and I had that hospital gown,
Mm.
like one of those cloth gowns. And I think I had it was like open to the back, and he would just like look up and see me like heaving. But he was like, it looks like you were twerking with your butt out, like every time I looked up. But anyways, once I got the epidural and like the nausea calmed down and things, again, thankfully I progressed in labor, and I literally pushed over one contraction. And I think I had like a superficial tear that they put a stitch in, but, um, I was really thankful to, I guess, have the knowledge that I have, and to also feel confident that my body would do its thing. And obviously not everybody has that knowledge, or has the can feel empowered enough to advocate for themselves in that way. Like
Mhm.
I remember when they called me complete, like, some 10 centimeters, but the head's there, but it's not like down far enough where I would push a little bit. I was like, oh, I think I'll labor down a little bit. Like, again, not to like say I was trying to dictate my labor, but I knew I didn't want to push for 3 hours. If I knew like my body would kind of do that on its own, I could start pushing when I felt that pressure, that urge. And I definitely felt that, even though I had an epidural and there, and she was ready to go. So um I think that experience, that my prior training and the knowledge and things like helped me get through that experience. Postpartum, I think I'd known enough about pelvic floor PT. I'm not obviously not a pelvic floor PT myself, but I knew enough to understand some of the things that I could do to early on, like I'm talking about in the first 6 weeks. And I have a
Mhm.
whole section in the book where I talk about that. Because a lot of people, again, they get this guidance after they deliver. We often say no heavy lifting, no submerging in water, and nothing inside the vagina for 6 weeks, right?
Mhm.
Um, but you know what? I think that there's a lot of things people can do. And if you're already picking up like a 7 to 10 pound baby in the first 6 weeks, like you can do things with light weights too, and you can do things that might help to reestablish your connection with your core and your pelvic floor, and put you in a position to prepare for returning to activity over the next few months. So I think I had a basic understanding of that. At the time, I was working with one of our fellows who was doing a research project and developing like a video PT guide through the pandemic. And so we were working closely with the pelvic PT department at the University of Southern California. So um, again, like that experience helped me understand the importance of, um, deep, like core breathing and reconnecting your breath to your core. I talk about in the book how it felt like my belly button had detached from my body. And I think that's the weirdest thing if you're someone who's athletic or who's been active for most of your life, you're used to feeling some sort of control over your
Hmm.
activities and, noticing like, oh, if I do this, I'll get stronger here. Or if I stretch that, I get, more mobility or flexibility there. But being postpartum, I was just surprised by how, um, after the baby came out, I was like, it should be easier to get up out of bed now, right? And like that first 6 weeks, just that combination of fatigue and the way that your abdominal muscles stretch out and everything, like you just have to give your body that time. So I do think I had a base understanding enough to start some of those simple exercises in the first 6 weeks, but I didn't truly appreciate how much time it would take until I got farther in the process and talked to more moms and talked to my friends who are in PT and that kind of thing. So,
Yeah. Can you talk about like everybody loves to talk about like rectus diastasis, right? Like, and like you kind of talking about your core muscles and the things that you can do. Can you give us a little like preview into that? Obviously, we encourage them to read the book so they can get more in-depth information. But can you
yeah.
give us a little preview into some of the things that you did and how long? You and the moms you talked to, how long was that process to really feel, I guess, like yourself again, right?
Yeah. Well, I think one thing I try to emphasize in the book, and I always say to my patients, is that once you have a baby, or once you go through a pregnancy, you're forever postpartum. Like your body is just going to change in certain ways that are not going to snap back. And you're going to gain certain strengths in other ways that are going to be new and exciting. Um, so as far as, some of the things that I did, and I'll actually also comment, after I wrote the book, I realized I didn't necessarily dedicate a section to diastasis because, again, as a pelvic floor specialist, like I'm literally like dealing with that area usually. So I'm not a PT and I'm not an expert in that area, but I do think that so first of all, it's important to recognize what it is because a lot of people, they'll come in with the symptoms of it and tell me about the symptoms of it, but they don't really know what's going on. So, yes, it's obvious if there's like a big separation and a hernia, like where there's, kind of this bulge, that's more obvious. And, we can send people to the right providers to deal with that. But for some people, it can be more subtle and it can show up as more of a pain or discomfort or just having that like truncal or core instability, low back pain, and that kind of thing. So one way that I check for it is if I'm doing an exam and they're laying down, I have them do a crunch, kind of like they're putting their chin to their chest. And if I can feel a separation in the muscles, like a centimeter or more, then that for sure I would have somebody see pelvic PT. And depending on how far out or if they've tried that already, potentially see a surgeon. But there are a lot of people who can recover from that without necessarily having surgery. So some of the exercises I recommend early on are, again, that connecting your core to your breathing. So learning to kind of, here, I'll do it with you guys, but if you put your
Hmm.
hand on your belly,
Hmm.
um, if you take a deep breath, you should feel your whole belly expand, and then also think about your pelvic floor kind of descending down. And then as you take a breath in, use your belly button to pull it in and up. And then also you compare that with a pelvic floor contraction. So those are like some of the simple things people can do
Yeah.
starting out, even before they start thinking about crunches and things. Like I don't think crunches should be really part of the a fitness program until people have met certain like steps leading up to that. And I tried to outline that in the book. Because once people are able to kind of consciously do that, and I started that pretty much right away postpartum, and I was just surprised again, like feeling like my belly button had separated from my body, like how weird that was to try and consciously do that. But once I had felt like I had a better handle on that, and then coordinating that with my pelvic floor, I started doing pelvic tilts, which I talk about in the book also. And if you start that on the floor, but you can do it in the chair, what it means is kind of like, as you breathe out, you're kind of going to a neutral spine, but then breathing in, kind of bringing in that belly button and scooping your pelvic bone under you. And once you're able to hold that for 5 to 10 seconds, then I think that that's kind of a safe place to start incorporating certain other exercises that detail more in the book. But
Mm.
again, something as simple as that, like being able to engage your core and
Mm-hmm.
sustain pelvic tilt position for 5 to 10 seconds, like that's actually kind of challenging when you're postpartum. So again, regaining that awareness and coordinating your muscles is very important. I think that people are getting a better appreciation of how pelvic physical therapy, or seeing a physical therapist who specializes in
Mm-hmm.
um, women who are pregnant and postpartum, just how important that is. So you don't even necessarily have to wait until you have a problem to see a physical therapist. But I do think it's important to acknowledge that access is a huge issue depending on your insurance and where you are, if there's physically just aren't people like this around.
Mm-hmm.
Um, but if somebody has the opportunity to start that in pregnancy, I would say definitely go for that. But then postpartum, again, there are some providers and PT who are physical therapy that are more experienced with working with women at this stage of recovery, even if you're in the first 6 weeks. So just because you're going to PT doesn't mean you're doing heavy lifting, or they're going to do internal work or anything like that. Like there's a lot of things that they can do without any of that. And actually, I talk in the book about using a doula, but basically doing it all virtually because it was the pandemic.
Right.
A lot of, one of the good things to come out of the pandemic is that a lot of people in healthcare have kind of adapted in that way. And so there are several PTs even here in Los Angeles, and I'm sure in other parts of the country, who are offering treatments and assessments and things online. So hopefully people are able to access that more. I think there's also this, renewed interest, not renewed, but it's like kind of trendy right now, I feel like, for certain nonprofits, organizations to be supportive of Black maternal health. So there's a lot of programs, I think, that are hopefully will continue to be funded, but some programs going on right now that are focusing specifically on that demographic or increasing access to BIPOC people. So I think being able to access that in whatever way you can is huge. But a lot of it just does come from first recognizing that just because you had a baby doesn't mean you need to suffer. Like, and that's like, right, like steeped in the Bible for a lot of people. But
Mm-hmm.
that's just supposed to be the way it is. And for a lot of women, they'll come to my clinic. Again, it's like, whether it's within that first year postpartum or 10, 20 years down the road, they'll say, how come my doctor never told me about these resources? Or how come, I tried to tell my doctor and they told me it was just normal. Like it's from all all my pregnancies and stuff. And, so we have a responsibility too, as providers, for
Yeah.
making sure people understand that these resources exist.
Yeah. I mean, so many important things that you said. And again, we unfortunately don't all get trained on that. Like I still I'm the active referrer to pelvic floor therapy. Um, our practice refers 1/6 of all their patients at our institution, but that's not something I necessarily got a bunch of training about in residency, unfortunately.
Yeah.
But now
And yeah, we
because
don't we don't
go
need
ahead.
to be the expert in everything, right?
Right.
But I do think we have to, like, especially if, we're seeing these patterns come up in the way that patients express things and stuff. But, the onus shouldn't always be on them to bring it up. But, recognizing that these things are so common and just knowing the resources that are available. I mean, I'm also still getting to know like the providers that I can trust with like patients in that peripartum period with this, with the PT and stuff. So
Yeah. Yeah, because all care is not created equal, right? And so
absolutely.
kind of finding who the people are that are going to be able to take really good care of your patients, it's like kind of trial and error. That's why I
Yeah.
tell a lot of patients, I'm like, if you love your doctor, please tell me. And I'll refer more people to them
Yeah.
because I want to create a list, like a directory of
Yeah.
providers.
Absolutely. Yeah.
So I'm curious, you kind of talked about this. You've hit on a lot of amazing points, but is there any like big misconception, like maybe you see in social media or maybe you hear people tell you, is there a big misconception that you would love to address and like share with people, like to clarify, or maybe that you address in your book that you want people to know about?
Yeah, I'll say a couple. One, a plug again for doulas, and I know you're have a doula training as well. Um,
Yes.
but even having worked with doulas in the hospital and friends that are doulas and stuff, I didn't understand how they can play an important role earlier in pregnancy and also postpartum. So, in my experience, I'd mostly interacted with them in the hospital setting. And sometimes, honestly, it was a little like felt like we were not on the same team, even though
Yeah.
we're supposed to all have this same goal of, supporting this person through their delivery. But um and I'd also worked with some amazing doulas too, who made me realize like having that type of support just makes a world of a difference. I think in somebody's experience and in their outcomes, we know that it does change outcomes as well, if in a good way. So I think that for a lot of people going through pregnancy, they don't necessarily have that village to support them. And I talk
Hmm.
about that too, how especially for Black women, we can be vulnerable to experiencing pregnancy um, with less support compared to other demographics. And so, considering a doula either early in the process or even just postpartum, if you feel that you don't want them there at a birth or something like that, like postpartum, the doula for me, having my mom there for like 6 weeks was amazing, and then having a doula for those first 6 weeks was also amazing because
Hmm.
there's certain things that there's certain ways that our moms like were told to do things, and guess what, things change. So sometimes things can be done better, and um I'm sure there's a lot of great doulas out there, but I just got so much great guidance on like dealing with like engorged breast tissue in my armpit. Like that was probably the most painful thing I was dealing with in the first 6 weeks, because everybody has, right, that talus fence, and to a different extent, like some breast tissue that goes up into the like armpit area. But I had this like golf ball size thing, and I'm in my armpit. It was so painful. And if I hadn't had a doula and known how to like express the tissue or to massage the tissue in that area and that kind of thing, like I could have potentially gotten mastitis or some sort of infection or other infection. Or so that for me was just huge to have that type of support, and especially from someone who like I would literally show up and like sometimes be like half dressed, like half asleep, like help me. But to just feel that type of support was huge. And again, I did that completely virtually. I had just started my job, so I couldn't afford, like, I in my mind, again, I thought like birth support was for people who like could afford a live-in nurse and nanny and that kind of thing. Like I was just coming out of training and was, you know, just starting a job and all this stuff, and now had a newborn. So to be able to access that through like virtual support and still feel that it was helpful, like that was huge for me. So one misconception, think about birth support in a different way, I should say, and really consider a doula. I think that was a very positive experience for me. um, the other thing I would say is, again, this idea of bouncing back. Like I talk about in the book how I did, one thing I left out was there's this event that they do at a lot of functional fitness gyms or CrossFit gyms called the CrossFit Games. And they put out from the like national corporate people, they put out like these workouts where like once a year you're able to kind of gauge yourself against like everybody in your gym and everybody in your region. And if you're like a elite athlete, you can qualify for like national competitions and stuff through it. But so it's a measure in a way of your fitness that comes around like once a year. And my goal when that first came up and I was like 5 months postpartum or something, again, in my mind, I'm like, okay, I should be recovered by now, right? And my goal was just to do everything as they had written it, or they say everything RX. And so to do like all the weights and the movements and stuff like that. And I thought like I was killing it just because I was able to do that. But I really just had to learn an appreciation for taking things slowly. And I think that's hard for everybody, but especially for an athlete. And if you're used to performing at a certain level, things are just different and they can get back to where you were. We see it's not just like people who see like Heidi Klum who walked the runway 3 months postpartum or whatever crazy stuff like that. But, same with like athletes, we see someone even like Naomi Osaka, who is just like, I think about a year postpartum or something, and now just compete at the Australian Open. And people think like, okay, so that means I should be bouncing back to where I was by X amount of time. Everybody's experience is so different. And there's so many factors that go into it. But we do have to keep in mind, like, people who do that for their livelihood, like, they have a whole team of people who are thinking of every single detail with their recovery. And thankfully now we have this precedent where we have athletes that, are able to go back to elite, athletic levels within a short amount of time, in a way that's empowering, but also it also just, I think, takes a little away from the reality that most people really just need time to recover. And I talk about in the book how I walked into a gym. I think now I'm like 6 months postpartum. And one of the coaches who I had a young kid at the time, she's like, yeah, it really took me like 2 years to feel back to normal. And I'm like, oh, there's no way. Like, I've been, I'm coming back and out to the gym already. Like, I already feel like I'm on my way. But it really did for me take almost 2 years. Like, there's so many little aches and pains that really just take more time and take some dedication and knowledge to rehab, and finding the right people to do that. Um, one of one of the things that held me up, I would say, was lightning crotch, which was probably a little bit of pubic symphysitis. But these like shooting pains I felt like were coming down my vagina when I first delivered, was like just walking, I would feel that. And so I think I did a 5K, maybe it was less than a year later. And it was around 11 months. And that was like the first time that I was really starting to be able to run without that. And then I intentionally worked with a trainer myself, and learned about certain imbalances in my body at that time too, to help, recover that better too. So there's just certain things that you just have to give time. And like, if you're a like average Joe or Jane or whatever, like most of the people out there who are trying to get in the gym, then you just have to really kind of pay attention to your body and be forgiving to yourself. And oh, by the way, you're also taking care of a young child. So, just giving yourself that grace and, accessing the resources where you can. And the consistency will pay off if you're showing up and doing, even if what you think it's the bare minimum and it's just walking around the block, like if you're just staying consistent, paying attention to your body, like things will recover.
So true. Consistency. That's hard for a lot of us, and
Oh
that's
yeah.
great advice.
Yeah.
Is there anything else you want to share, like with the Birth Squad or anybody else? And then also at the end, we want to ask, how can they find you and connect with you as well?
Oh, for sure. If I could recommend anything, I talk in the beginning of the book about how, I think I had developed this unhealthy relationship to fitness and using it to kind of mask certain stressors that I actually really need to face and deal with in a more appropriate way. But I do still believe that fitness can be a very positive way to, obviously we know, releases endorphins. It helps you sleep better. It helps with your resting heart rate and your cardiovascular health, all that stuff. There's so many benefits, but I do really believe that at the same time, once I was able to give myself that time, reframe my approach to fitness, being active and having small children can be such a great way to reclaim your time as a
Mm.
mother. You're giving so much of it away just taking care of children. And then, if you're a working mom too, or working outside the home, so much of your time is divided to things that just are not about you. And for me, I really appreciated once I got, more towards 2 years postpartum and I was training for a triathlon, just how just good and indulgent like it really felt to take that time for myself. And I don't even think you have to be a mother to appreciate that, but when you're in a mother role and you're again just giving so much of yourself away every single day, to be able to take 15 minutes, 30 minutes, an hour, or whatever time you have to be active and to do something that's taking care of yourself. It's just such it's hard to explain, but I say like it's a spiritual experience. Like I, as I was going through my triathlon training, like it really was um, spiritual in that, it helped me realize how much stress had like worn on my body, not just physically, but emotionally. I think part of it too at the time was that like when I was training for the triathlon, I realized they wouldn't allow headphones during the race. And I was like, oh, this is the first time I'm working out without music. And so I was just in my head a lot. And especially with the swimming, like I'd never done distance swimming like that. So um, I think like if I can encourage any mama to just take some you time and to use it to do something that's going to benefit you mentally, emotionally, physically, just do that. Like that time needs to be yours. I think a lot of men in our society get a pass to just like go to the gym, like, and they don't need to ask permission. A lot of times we feel like we just need to ask permission. And for me, once I kind of flipped my mindset around that and I was like, no, I'm doing this. Like, I'm gonna be gone at this time. So like that's happening. It, for me felt just very empowering and just good, hard to explain. Otherwise, as far as how people can find me, I have a website for people that are interested in looking me up as a clinician, www.draldene.com. So www.draldene.com. I also post on Instagram and Facebook occasionally. I'm getting reacquainted with Facebook because I know that a lot of my patients are using it, but I'm mostly on Instagram at it's at dr.aldene, but it's spelled out, so doctor.aldene. I also, as you mentioned, have this book coming out and it'll be coming out this week, so that will be on Amazon as paperback, and I'm so excited for that. So be sure to look out for that as well.
Can you just once we release it, can you just say the date so people know it's available by what date?
Oh yeah, so it'll be available by Tuesday the 23rd. So that's coming up in a few days.
Yes, it is exciting. Thank you so, so, so much. Such great information. I even learned a lot of things from you during this conversation, and I'm definitely going to share your book and our conversation with other people. Like when you were talking, I was thinking of the people in my life. I was like, okay, tell them about this, and I can tell this person about this. So
Yeah.
thank you so much. We
Yeah.
really appreciate you taking the time out of your day to talk with us.
Of course. Thank you for having me, and thank you for putting together this podcast. Like we need more platforms like this to let people just talk about their birth experiences and their stories.
Absolutely. And share their successes too. So we got to lift each other up
Absolutely.
in the community.
Absolutely.
All right. Well, thank you so much and take care.
All right. Thank you.
That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts of your experience, and we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad, and check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Okwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from The Birth Squad.